How does gender identity differ from sex assigned at birth for trans youth? Imagine feeling like you are living in a body that doesn't quite match how you see yourself. That's what many transgender youth experience. Today, we're going to explore what gender identity really means and how it differs from the sex someone is given when they are born. Gender identity is a person's inner sense of who they are as male, female, both, neither, or somewhere else on the gender spectrum. It's how someone feels inside about their own gender. This feeling is deeply personal and often stays consistent over time. Some youth know their gender identity from a very young age, even as early as 3 or 4 years old. On the other hand, sex assigned at birth is based on physical features like genitalia, observed when a baby is born. Doctors record this information on birth certificates, usually labeling the baby as male or female. This classification is meant for medical and legal purposes, but it doesn't tell us how someone actually feels inside about their gender. For many transgender youth, their internal sense of gender does not match the sex they were assigned at birth. For example, a child assigned female at birth might feel like a boy, or a child assigned male might feel like a girl or identify as non-binary. This mismatch isn't a choice, it's part of who they are. Recognizing this difference early helps parents and caregivers support their children better. Understanding the distinction is important because sex assigned at birth is based on external physical traits, which can be different from how someone feels inside. Gender identity is about the internal experience of being male, female, or another gender. Supporting transgender youth means respecting their gender identity by using their chosen name and pronouns, and helping them express themselves comfortably. Parental support plays a big role in a young person's health and happiness. When parents accept and affirm their child's gender identity, it reduces feelings of distress and helps prevent mental health issues like depression or anxiety. During adolescence, when physical changes happen, support becomes even more important. It helps youth navigate puberty safely and confidently. Providing gender-affirming care might include counseling, social support, or medical options like puberty blockers or hormone therapy, when appropriate and with informed consent. Creating a supportive environment at home and school helps youth feel safe and accepted. In summary, gender identity is how someone feels inside about their gender, while sex assigned at birth is based on physical traits seen at birth. Recognizing and respecting a transgender youth's gender identity is key to their health and well-being. Parental support and understanding are essential in helping them grow into confident, happy individuals.